All of us will have a wound at one time or another. It may be due to trauma or due to surgery. We are mostly going to focus on surgical wounds at this point, but the principles can be applied to traumatic wounds also. Oftentimes, we let wounds heal best by second intention or natural wound healing. In order to take care of your wounds, you will need to buy a few supplies: white petrolatum and bandages. You do not want to put your finger in your white petrolatum over and over again because that will contaminate it. So Q-tips are often a good idea, so you can dip them in and not double dip. In order to clean your wound, the first thing you need to do is take off the bandage and clean it twice a day. You may use straight tap water or hydrogen peroxide mixed with tap water. After you cleanse your wound, you need to bandage it. You want to keep it greasy, so first apply white petrolatum and then your bandage. Non-adherent bandages are often better because an adherent bandage may stick to the wound. Sometimes wounds are painful, so what should you take? We usually advise Tylenol since it has less of a risk of bleeding associated with it as compared to ibuprofen or other non-steroidal medications. What about an antibiotic ointment? This is a wonderful question and one that I get regularly. Studies have regularly and repeatedly shown that using an antibiotic ointment does not decrease the risk of getting a secondary infection in your wound. It does, however, increase your risk of getting a rash or contact dermatitis to your wound. When that happens, it is then difficult to tell if you are having an infection or just inflammation. So to try to avoid that, we advise just Vaseline. Will the wound become infected? Well, infection is not likely to occur. There are some signs to show a wound may be becoming infected if it is warm or smells bad. Another question I commonly get is, can I get the wound wet? Well, yes, it is okay to shower, but it is not okay to submerge the wound in water for a long extended period of time. Another common question is, should I let the wound dry out and scab? Resoundingly, we say no. Scabbing tends to lead to an increased risk of infection and scarring. Therefore, we like to keep our wounds wet and moist and protected. Wounds can be left uncovered for brief periods of time if need be. We like them covered to try to leave out dirt and debris. If you have bleeding from your wound, we advise you to elevate it above the level of your heart if possible and apply pressure. Some people think that you only need to apply pressure for a short time, and when holding pressure on your wound, time seems to pass slowly. So we often advise setting a timer for about 20 minutes to hold firm, constant pressure on that area to try to prevent the bleeding from continuing.